Hi, Pat.
Hi, Shana. Here we are again.
That's right. Here we are again.
Yeah, nice to have this opportunity once again to provide information for the candidates
taking
the exam in 2020.
Yep. And there's a lot of information to cover. I know there's a lot of questions, both for the candidates and the programs and educators who are advising them. So I think this quick update will be helpful to multiple people, and that's kind of what we hope, you and I hope, is that we're reaching everybody. We're not here to answer all the questions today, but definitely try to answer some.
Yeah, absolutely. I think everybody's feeling maybe a little isolated and not having that opportunity to get together to talk about these things. So hopefully we can share some information today that sets some people's minds at ease, reduces the panic level and the anxiety level, and just good to share the information and get additional questions if they have them.
Great. All right. Well, I'm going to go ahead and start our presentation as we always do. And so Pat and I both welcome all of you to this short but quick and brief webinar. Again, we aren't trying to answer all the questions today, but just kind of give you an update, really, and provide you some information, because information is traveling at light speed right now. I mean, it just is quick and fast, and so we want to participate and get some of the information out directly from the CDCA. So some information that is currently changing daily are these are the dental board meetings and their acceptance of examinations and types and all those things. What we have created on our website is an interactive map for you to be able to log in and see what states are doing. And again, we're gathering this information. If there is any confirmation, you need to get that directly from the state board. This is just a resource, but not intended to be the definite answer. So if you see something, you have any questions, it is still best to contact the state board to confirm any information on this map. But you can access this map, I did want to show you, right from our website at cdcaexams.org. Under that info tab, you'll see an ADEX button. If you'll click on that, there'll be a purple map on your right-hand side. Double click on that, and you'll see both a dental and a dental hygiene map. Pat, this map has been great as far as a resource. Have you had any chance to look it over?
I have, and it's been a great resource I think for candidates, and it's been a great resource for national boards too, as they make their decisions on what licensure is going to look like in their states.
I don't know if you noticed, the fun thing about this is when you are on this map and you hover over each state, it'll give you even more details. So, of course, every state on the map that's purple accepts the ADEX exam and ADEX dental hygiene examination. And then we've indicated some different rules and regulations, and you can see the little agenda down there that tells you what each thing means. The legend, that's the word I'm looking for, the legend. The legend. And so, but in addition to that, if you hover over each state, you can find additional information. So I'm really proud of the team that put this together, because this is a lot of work to manage this, right? You, myself, some other key members at the CDCA are attending these board meetings, and then an additional team is behind that, making sure that this information is accurate. So lots of information going out all across.
And I think emphasizing that it is updated all of the time. Today, I am participating in 2 state boards, so the information could very well be different tomorrow,
right,
or the beginning of the week. So it's good to go back and just keep checking this, and check the states that you're interested in getting licensure in. It is a terrific resource.
The other neat feature that we've added recently on our website is, again, under that same info tab, but if you scroll down, the CDCA newsroom. So again, a lot of information is coming not only from us, but from ADEX and thereabout. And so under this newsroom, you can see any press releases. This video may very well be there. There'll be all kinds of places to find information, and this newsroom is a great resource. Pat, you had said that the clock would be chiming. It must be 11:30.
Yeah. There's going to be 3 clocks that chime on the hour. So
So again, check this info tab and go to the CDCA newsroom for the most recent updates as far as what the CDCA is providing right now. Great resource as well.
I think having the newsroom is great, so that so no one has to go through and look for changes in the website, whatever. It directs them right to what's current, and it's a quick and easy check for people.
Yeah, it's been a great resource. Actually, this is one, besides the map, this is our second most visited site right now, just people trying to keep up and get updates. So very exciting. Good addition from the CDCA for sure. You know, Pat, this was something that we had sent out to the candidates this week. I'm going to let you talk about this, but this is kind of to some of the changes we've had to make as far as exams and pandemics and all of the requirements and rules that we're trying to maintain for everybody's safety.
Right, and again, when we talk about things changing, and of course, as states open up and as public health departments start making decisions, we follow along. So hopefully you found this information in the modifications and the examinations. Hopefully you found this more helpful than confusing. I know it did get many of you on the phone to your program directors, and the program directors' phones were ringing off the hook, but I think it's good that you get the information so that you just know what types of modifications. Obviously, our infection control is one of the topics, and the PPE, it's all outlined in there, and what you should be wearing, and working with the schools and staying in touch with all of the schools. Aerosols is a big issue, and I think this is where you found out about ultrasonic use, or the policy of CDCA not allowing the use of ultrasonics until it will revisit its policy coming up on the 1st of September. So we'll direct you to this, read it again. It also describes if you are going to be taking an exam and are not going to be able to use ultrasonics, their ADEX has allowed additional time. You will have an additional 30 minutes. So a patient-based exam not using ultrasonics will now be 2.5 hours rather than the 2.
Where can they find this if they didn't get this, or program directors want to go back and refer to it?
Again, it's on our website. And it's is this the one that's at the beginning of our manual?
Yep. When they go to the manuals page, they'll see it by itself, and they'll also see it as the first page of in that manual.
Okay. Again, like in the newsroom, you don't have to go all the way to it's right there under manuals, so that you can go to it and look at it, and good to just keep going back and referring to it so that you know what to expect. If there are changes that come up, it will be updated. But as of right now, this will be a good guide for you for the updates.
Yep. So the one thing we just want to make sure that we visit here is that the ADEX dental hygiene exam is still 2 components, right? We require the OSCE, which is a written exam, and there's been a lot of communication about this OSCE at state board levels, and then on down to our schools, and then of course our candidates are asking as well. So the OSCE is the written portion of the ADEX exam. It's always been part of the ADEX exam. So this is something that you're used to. It's not a new addition, right? It is still the same OSCE that candidates taking the ADEX exam have taken. In addition to the written component is that patient treatment component. Pat we've got an exciting announcement, which I know has already really hit the news stream, but we'll talk about it in a minute. But we do have the patient treatment and soon an additional component that can be used in place of the patient treatment if needed and if approved by a state board. So again, ADEX exam is still 2 components. The one question you might have, though, is about signing up for the OSCE, right? So if you're a candidate taking this exam, the OSCE is an exam you should go ahead and sign up for and get your date. Prometric, who is where these exams are delivered, are having to meet the social distancing guidelines and rules and requirements. We've been fortunate that many candidates have been able to get their appointments rescheduled if they had to. But if you don't have your appointment yet, go ahead and make that appointment and get that on the books. in addition, we may host some pop-up testing sites, but that's to be determined later on. So in the meantime, while we're in this slow time, we do know Prometric can and is able to schedule appointments. So go ahead and get those appointments made for your OSCEs.
Yeah, I think that's good advice, Shayna, because I don't know how far out they're scheduling, but it's good to have that goal and get that appointment scheduled so it's not holding you back.
Yep.
Prometric is an organization that a lot of testing agencies use, so there's going to be a lot of call for it. So better to get an appointment, even if it's a lot of weeks out. This is a form that should be really familiar to you. It's in our manual, and it is the content and the criterion scoring for the PTCE, which is the Patient Treatment Clinical Exam. It has not changed. The points are still the same. The criteria is still the same. A change that has been made across ADEX is that 18-month rule is waived, where you had to complete all of the components of the ADEX exam within 18 months. So those of you that maybe already took the CSEE before this, all these shutdowns and the COVID crisis struck, you're not going to, that was the start of your 18-month rule. But that has been waived. Everybody realizing that exceptions have to be made and that people need leeway. I already mentioned the no ultrasonic scalars on the patient treatment exam. It is hand scaling only. That is a CDCA policy based on the guidelines of CDC, American Dental Association, American Dental Hygiene Association. That policy will be reviewed on September 1st or the beginning of September. And if there is reason to change the policy, it will be changed. But we can't guarantee, we can't look ahead. We don't know what's going to be happening in September. So it may, the policy may still stay in effect for a longer period of time. We'll just have to wait and see where we are at that point. And I mentioned there is that additional 30 minutes of time for the total of 2.5 hours if you're going to be hand scaling. So for patient treatment, those are the changes, but the exam itself is remaining the same. Everything that's in your manual is basically the same as has been that you did mock boards for, or the Manikin that hopefully the manual that hopefully you've been reading.
So Pat, I have, we get this question a lot from candidates here lately, and the stress and anxiety of, no ultrasonic scalars, just the words alone make them nervous. If, what options, I know you're getting ready to talk about another big option for them, but if an exam's at their school and it falls under this policy, they don't have to take the exam at this time if they're not comfortable.
Right. I think that's a message that we really want to get across to all of the candidates is this is an important step. This is an important examination in your life, and do it when you're ready to do it. Take it when you're feeling prepared and the conditions are right for you. If you feel you want to use an ultrasonic when you do this exam, then maybe you want to postpone your exam and not take it while that restriction is in. Will the restriction be there forever? No, it won't be. Someday it will be gone. But it's important to go into this exam feeling comfortable and confident and doing it on your terms. What's going to be best for you? So don't feel the pressure that it's at my school, I have to take it, or everybody else is taking it, so I need to too. No, this is important. Do what's best for you and do it on the timetable that's going to be best for you. So you can wait. You can wait until after September 1st. You may have to travel to another site to take an exam. But I trust there's going to be a lot of exams throughout the fall. And that there's a lot of people, if you're thinking about postponing because of ultrasonics, I think it's fair to say that a lot of people might be thinking of postponing because of ultrasonics. So you will have an opportunity to take the exam when that restriction is lifted. It may be September 1st, it may be later in the fall. It is something that I think we've all learned we need to have a high flexibility quotient to get through these times.
Right.
And so I think that's our best advice. Don't go ahead and take it if you're not comfortable taking it. But
you have another option for them, I believe.
Right. Ta-da. We do. Ta-da. As of a week ago today.
A
week ago today, ADEX has accepted a substitution for a patient by using a Manikin, so that you can take a Manikin clinical examination along with the CSCE OSCE. This is a clinical component that is in place for 2020 during the COVID crisis. And depending if it's accepted by the state in which you want to practice or you want to go to, this is another option for you. The exam, the ADEX tried to keep the exam as close to the patient-based exam as possible. So you're going to see a lot of familiar things there. The treatment that you would be doing if you opted to take the Manikin exam is the still calculus detection. You'll be doing it on 4 assigned teeth rather than 3. Calculus removal is exactly the same, 12 selected surfaces. Periodontal measurements, rather than just doing linguals, you'll be doing 12 surfaces. And the final case presentation will be the grading on those, the removal of calculus on those surfaces other than the 12. So it should look very familiar, but just a little bit different. You'll
familiar but the same, huh?
Right, yeah. So, you'll notice there's no tissue trauma here. You're not going to be submitting a medical history. Blood pressure is not an issue for that Manikin. So I always say the only real blood pressure issues are the candidates. And if we ever had ceilings or blood pressures that would stop participating in the exam, I think patients are better than candidates. So It's a good thing. It's a good thing we don't screen you. So this is a possibility. This is an alternate modality for you to take the clinical examination if it's something that's right for you. And the big issue here, which brought us to the discussion, is on a Manikin, ultrasonics are allowed. There's not the production of aerosols. That is the concern of patient-based exams. So this examination, you want to talk about, Shana, when will it be available and how do people sign up for it?
Yeah, sure. Yeah, so this exam will become available the beginning of July. And if you're a school who's considering this option, please reach out and let us know. You can contact us. You can contact Maria with our exam site services team who can help with that, myself as well, in looking and going towards a Manikin exam. The one thing I do want those to know is that Pat and I will make a very specific, more detailed resource like we have for the patient treatment exam about the Manikin exam. We'll go into the criteria and really dive into it. This is just a quick overview of what that is that we've introduced, but do know that we're preparing more resources behind this to be helpful to all those who will be taking this examination. And the patient resources are still online as well. So, there's going to be a lot of resources to help prepare, in addition to myself and Pat being available. When you sign up, and if you've already signed up for an exam, right, there's nothing different that you need to do. We, though, at the CDCA will assume that everybody who has signed up for an exam is taking a patient-based exam, unless you notify us that you would like to take it on a Manikin. And the way that will happen, the way you'll notify us, is we will send out a survey somewhere between 3 or 4 weeks prior to the exam, and then ask you what your preference is. And that survey will be the key to you replying to us, letting us know what your preference will be. So, we'll continue to communicate all of these things, even today. I mean, we are putting this together so quickly for you all to get this information out there. So, we're being flexible and ask that you be flexible as well as we keep moving. But those of you interested in this exam, really what I want to let you know now is there's nothing more. If you've signed up for the full exam, there's nothing more you need to do right now, except know that you don't have to change your patient to a Manikin. All of that we will handle internally with you directly. No changes as far as your portal goes.
Yeah, so hopefully that information can kind of calm people down as to, is there something that I should be doing, and is it a different sign up and whatever. Just everybody kind of stay where you are and wait for more information to come out, and wait to see what's happening in your state. I think we've all learned to be patient, or we're learning that we have to be. Maybe we haven't learned the lesson so well, but we need to be patient. And there's just a lot of things we don't have control over. And I think that's one thing that I empathize with all of you who are trying to graduate from school, get your license. How are you going to go about it? And a lot of it is out of your control at this point. Bigger decisions need to be made. And then you can filter in to try to control your own little part of it about registration and whatever. Yeah. So we want to do our best to provide you the broad information, and at a later time, we'll give you the specifics, as Shana said.
So, Pat, I do have a question for you. So what if, we've got a school who they've got some candidates that want to take Manikin, but others are going to states that still need a patient-based exam. Can this be done at the same time? What does that look like?
That's a topic that's really up for discussion right now, and we really are looking to being able to do that on a site. It's just, how do we do the logistics of it? We need to keep social distancing. The grading is going to be different. So if a school is interested in something like that, we will work with each school individually. I think that's going to be the name of the game for this exam season. It will be one-on-one interactions with schools and helping to plan out the exam that happens at that school. So the goal is to be able to offer both. Exactly how logistically we're going to do it, maybe have all of the Manikin takers work at once on one session and then have patients at another session, is a possibility. Again, we need the input from the schools, from the directors, along with our staff at CDCA to make those best decisions. But hopefully, that's the long answer. The short answer is yes, we're hoping to be able to offer both exams at one site.
But a school could say, we only want to do the Manikin. I mean, they can just say, and they'll let their students know, and those testing at that school know, we're a Manikin only site if need be, if that's a choice. That is their choice.
Right. The schools do. We will offer the exam that they request.
Okay.
If they request a patient-based, if they request a Manikin-based, or a combination. Again, the combination's a little bit more challenging, but I think we've found ways that we're going to be able to do it.
Well, this was at least, across the board from schools to candidates and from us, this was big news this week. It feels like it's been forever. But this was big news this week. And so I think a lot of people felt a little bit less anxious because they now have an option, right? Where before this week, it was like, how am I going to find a patient? All of the whole checklist, that they go through before they're even usually out of school, which was, unfortunately ended early for all of them. This brought some light that, they might have some options if the state that they're wanting to practice in will accept this as a pathway.
As a pathway, right? Absolutely, and I think that's an escape valve for some pressure for a lot of people to just know that there are options. But hopefully, everyone out there realizes that CDCA is just really trying to do its best in helping come up with viable solutions to the examination and helping you get through it And I think one way that we're going to be able to do that is by providing you more resources, more videos, as we have in the past. It's new, and there's just know that there's a lot of people out here that are willing to help.
Yeah.
And to help you get through this, for sure.
Well, and so really quick, we've got 2 follow-up slides here of questions that unfortunately Pat and I have to write these down to make sure that we remember to cover them.
Right. So, or we finish this and we go, oh, we forgot to do this.
So it does look like, for the most part, we've covered all of these questions, except for when my scores get released. So your scores, you will get those scores. If you take a patient-based exam, it will be the same as always. By the next business day, usually your scores are posted. On this Manikin-based exam, though, they will not be graded on site. So they will be graded. You'll do the work that you have been asked to do. You'll put your stuff back in the box and turn your work in. And I was telling a group the other day, you'll give us a virtual high five on your way out the door. So, and then we'll grade those back at our central office, and those scores will be available sometime after they get back and are able to be graded. What we have to consider is how shipping time and things like that. But do know that the CDCA works hard to grade these in a timely manner. They won't just sit for a long period of time. We will get them graded as quickly as possible and get those scores posted for you to have access to.
Right.
And then let me see, did we hit all the highlights questions from the schools? Oh, Pat, the one thing we didn't really cover was, what does their school need to provide if they did want to do a Manikin-based exam? That was one that, well, again, you talked about that this would be an individual school by school scenario, and that same situation happens here, where you'll work with the CDCA to figure out what the school already has. And if the typodonts, which we provide, by the way, we do bring a full typodont. It will be mounted on the chair just like a patient. So you are working in the same manner that you would have worked on a patient. And that's where we come in to review and make sure the product you have at your school can accommodate this. And then if not, what can the CDCA help provide to make the school able to host this exam in that format? So we've got some options.
Right, and I think that's where the one-to-one relationship with the schools and the office that's how all of these questions will be answered. But just to know, in planning ahead, the social distancing, we're prepared for social distancing, and know that what used to be a clinic that used to be able to have 12 candidates at one time, we know chances are pretty good that we're not going to be able to do that, whether that be patient or Manikin. So again, as I say, our flexibility quotients are high, and
Yeah.
we'll just do whatever needs to be done to make it work.
Yeah.
If it means an exam used to be 2 sessions and now needs to be 3. Yeah. That's what we'll do. We'll do it to make it work, and what the schools so the schools can be prepared with what they have to provide. And the importance of candidates being in touch with the schools and checking the site information sheet to know what it is that will be provided and what it is they have to provide for themselves.
Yep, I agree. And I want to commend everybody that we're speaking to that's listening to this, because as you mentioned earlier, this is not an easy time. This has been stressful, but what Pat and I, really the purpose and the goal was to bring this information to you directly from us, and try to ease some nerves, to let you know, look, we're here. The CDCA is working. We're working at the central office harder than ever to meet the needs of those candidates. I mean, we truly are here to serve you and the schools and the needs that we can from an organization perspective, to make sure we're doing our part and getting everybody back into private practice. And back into practice, just into practice. Yeah. Right. So, well, Pat, I thank you for your time today. I know those joining us also thank you for your time, and to all of you out there, again, thank you for joining us. Pat and I enjoy doing these videos a lot, and we'll be making some more for resources for the Manikin treatment clinical exam.
Yeah, and please be in touch with us if there's more information that or a topic that you would like a video on. We're open to requests. We have a request line, so let us know whatever we can do to help you be successful and calm down if possible. But we admire your fortitude. It's not been easy, and we know that.
Yeah, we do.
Yeah, good for you.
All right, everybody, have a great day. Pat, we'll see you later. Thanks so much.
Okay, thank you, Shana.
Bye.
It's been fun. Bye.